Welcome to the Juvenile Drug Treatment Court Program Performance Measures Training. Today we're going to talk about understanding your program data, how to prepare it, how to collect it, how to track it, and how to report on program data. Understanding and reporting useful and accurate data is a critical component in the solicitation and award process and can help both yourself and your program manager gain key insights on many decision-making factors, whether those factors be related to time, resources, or funding. OJJDP uses performance data to not only understand the agency story, but also to demonstrate outcome-based results. In this training session, we will go over the revised performance measures, and we will discuss collecting and sharing information to help all of us better understand how well the Juvenile Drug Treatment Court program is operating on the ground. Now, to make this session as interactive as possible, we're asking that you use the WebEx chat to respond to any questions that you see on the screen. So, for example, the question here helps us better understand you and your needs around collecting, tracking, and/or reporting data. Take a moment and think about your biggest issue with collecting, tracking, and/or reporting data. What would that be? Wendy has responded, getting responses for 3-month follow-ups. Thank you, Wendy. NCJFCJ. Shelley has posted Suffolk County, New York, Juvenile Treatment Court, post-program outcomes. And Katie Mitchell has posted Rankin County Youth Court, Tallahatchie, Mississippi, Paul Bowen and Katie Mitchell. Systems that don't communicate with each other, uniform and timely data entries by staff don't always occur. And Janet has posted Janet Hawley, Arkansas Administrative Office of the Courts, inconsistent use of statewide data management system, lack of funds to extend use of statewide case management system. Thank you, Janet. And Diana has posted, this is from Rockdale County Juvenile Drug Court, having data organized for reporting. Thank you, Diana. Okay, we'll move on then. Thank you, everyone, for those posts. The agenda for today includes the following program overview: performance measures, collecting and tracking data and best practices, reporting data and best practices, as well as reporting in a pandemic and what to do with personally identifiable information will be presented. Lastly, we will review key documents and resources. As we progress through the training, all website links mentioned during the training will be presented to you in the chat box and also provided to you in your copy of the presentation that will be emailed to you later this week. The objectives for today include understanding what the performance measure updates are for your program and understanding the need for a data collection plan for the data you collect between July 2021 and December 2021, reporting in January 2022. Further, you will gain understanding of the performance measure reporting due dates. Now, as you know, those due dates happen twice a year, July 30th and January 30th. And lastly, you will understand where to find supporting resources. In the showcase sessions we conducted last April, we talked about the newly updated performance measures as outlined in your solicitation or award and located at OJJDP.ojp.gov website. This training is being presented to you to emphasize the fact that now is the time to start planning on collecting and tracking data for the July through December 2021 reporting cycle, with the goal of reporting January 2022 on these newly revised program measures. I'd like to pass the microphone to Sarah, who will go over the performance measures with you. Sarah?
Thank you, Rebecca. In the intervention division, we have several programs. the programs that we're talking about today is the Juvenile Drug Treatment Court program as part of the Intervention Division. Juvenile drug treatment courts are designed for youth with substance use disorders who come into contact with the juvenile justice system. The new guidelines provide juvenile drug courts with an evidence-based, treatment-oriented approach that emphasizes family engagement and addresses the substance use and often co-occurring mental health disorders experienced by the youth. OJJDP partnered with a research team, experts in the field, and other federal agencies to develop the guidelines to support judges and professional court staff, young people with substance use disorders, and their families. The guidelines are organized into key objectives with corresponding guidance statements and include rigorous supporting research and considerations for implementation. So let's remind ourselves of the performance measures process and then discuss the newly updated performance measures. As you review these with me, please note that these are newly revised performance measures, but you will recognize some of them since not all of them were changed. Juvenile Drug Court is working on the following program outcomes: to increase the number of new juvenile drug courts implementing best practices, to reduce youth substance use disorder and relapse rate, to decrease youth recidivism, and to increase youth living productive lives. 3 important things to keep in mind about the program include the performance measures that grantees report on. These are individuals served, service delivery, family engagement, training and technical assistance, prevention intervention, protective factors, and implementation measures. And what is different about this program, or some standout features that make it unique? The juvenile drug treatment courts are designed for youth with substance use disorders who come into contact with the juvenile justice system. And who are the grant funds intended to help? They will increase the use of juvenile drug treatment courts to prevent youth substance use, rates of relapse, and further involvement in the juvenile justice system. The framework or logic model used to write the performance measures includes 4 components: inputs, activities, outputs, and outcomes. Inputs are program resources such as grant funding and award administration. Activities are actions that convert inputs to outputs and can be anything from identifying key personnel with access to crime and alcohol abuse data to establish information sharing agreements. Outputs are products or services that are the result of activities such as trainings and meetings. Outcome measures speak to the longer-term program goals. The newly updated performance measures will require changes in the way that you collect data, and that's why we're here today, to ensure that you understand that you will be reporting on the newly updated performance measures during the July through December 2021 period come January 30th of 2022, and that you have a plan in place to do so. The performance measures document the progress that you have made in accomplishing program goals and objectives by collecting data on grantee activities and services. Remember, regular reporting on performance measure outcomes establishes your program's growth. You can find your program's performance measures at this online location listed here on the slide. OJJDP identified and organized the newly updated performance measures to include 3 different categories. The categories include overall measures, multi-program measures, and program-specific measures. In overall measures, grantees will be asked the same overall questions in every program. This allows analysts to aggregate data across multiple programs and assist with responding to ad hoc data requests. Multi-program measures impact 3 different types of populations. One is shared targeted populations, such as children involved in the child welfare system or tribal youth. A second one is those with a similar service delivery model, such as mental health services or prevention services. And 3, those with shared outcomes, such as youth provided with defense counsel. Program-specific measures collect data that align with a specific population, funded activity, or desired results. These measures help reflect the unique outputs and outcomes for each specific program and distinguishes them from other programs. Program-specific measures also help track the progress of individual programs over time. Next, let's look at the performance measures for your program. Again, we may not be able to go through all of them, but I wanted to highlight those that I thought may prompt questions over the next 6-month data collection period and continuing through the life of the award. To report this overall individual served measure, you will report on the number of individuals served by population. This performance measure captures the total number of individuals served and is broken down by the number of children, youth, young adults, parents and legal guardians, and additional family members. Since OJJDP funding is targeted to serve children and youth, the various categories of individuals served help OJJDP isolate the true number of children and youth served. This measure also captures the number of individuals who were carried over and the number who were new admissions during the reporting cycle to avoid duplication. Percentage of eligible individuals who abstained from or reduced substance misuse is the next overall measure that we will discuss. Substance misuse is defined as the risky use of substances without addiction, including heavy or excessive use of alcohol, underage drinking, any use of illicit substances, and use of prescription medications without medical justification. Use of illegal substances includes, but is not limited to, illegal drugs, prescription and non-prescription drugs, and alcohol, depending on the legal age to use a substance in local, state, and federal statutes. Abstinence is defined as not misusing substances. You will provide the number of individuals who received services for substance misuse, who abstained from illegal substance use, the number who abstained from legal substance use, the number who reduced illegal substance misuse, and the number who reduced legal substance misuse. In this slide, we're highlighting an example of a service delivery multi-program measure. Percentage of eligible individuals served by a substance use disorder treatment service is defined as the services that help an individual with a substance use disorder to improve a situation, relieve symptoms, manage a crisis, or deal with an issue through communication with an attention given to the individual experiencing the issue. Treatment usually involves a developmentally appropriate intervention or therapy. You will simply provide the number of individuals served who received substance use disorder treatment. Now we're moving on to talk about the program-specific measures. The first one is percentage of guidelines employed by a juvenile drug treatment court. This program-specific measure will require grantees to look into the juvenile drug court guidelines and identify how many of those guidelines they were able to employ. You will provide the number of guidelines employed by a juvenile drug treatment court and the number of juvenile drug court guidelines. We calculate the percentage by taking B over A. Percentage of professionals and practitioners who used family engagement strategies with fidelity is a program-specific family engagement output, and it captures the number of professionals and practitioners who used family engagement strategies with fidelity and the number of professionals and practitioners who used family engagement strategies. Family engagement activities may include setting goals, developing case plans, making joint decisions, and working with families to ensure their child's safety and well-being. For this measure, you'll provide the number of professionals and practitioners who used family engagement strategies with fidelity and the number of professionals and practitioners who used family engagement strategies. And then we calculate the percentage by dividing A over B. Percentage of guidelines employed by a juvenile drug treatment court is another program-specific outcome measure. The Juvenile Drug Treatment Court's guidelines outline the policies and practices on how to establish, manage, and operate a juvenile drug treatment court using evidence-based and effective practices. For this, you will report the number of guidelines employed by a juvenile drug treatment court and the number of juvenile drug court guidelines. And then in the definition, you will see the different objectives that are laid out and defined. The last program-specific measure asks how the number of new juvenile drug treatment courts are established. This measure is closely related to one of the goals of the Juvenile Drug Court Program, which is to increase the number of jurisdictions operating a juvenile drug treatment court that are in alignment with best practices for juvenile drug courts. For this measure, you will simply provide a count of the number of new juvenile drug treatment courts established. And now I'm going to hand it back over to Rebecca.
Thank you, Sarah. We've got a short scenario for you. Brenda Sokup, she is a juvenile drug treatment court awardee, and she's just received the newly updated performance measures. She's attended this learning event, and she's sitting at her desk wondering how to get started. What would you recommend Ms. Sokup do to prepare for data collection in the July to December 2021 period, reporting in January 2022? If you'll go ahead and respond to this question, how should she get started? She has her performance measures, she has her definitions, she has her questions. What does she do next? How does she get ready? Wendy is posting, read through the JDTC guidelines to ensure implementation is occurring. In the past, we've had people who have noted that she should familiarize herself with these measures, definitions, and questions more closely, that she should determine who will be responsible for capturing and tracking the data, that she will want to know who is responsible for reporting the data. And Dwayne has posted, look at her current data collection methods. She should also be aware of the reporting process. FY19 and prior grantees continue to complete reports in the PMT and submit them in JustGrants for the July submission period. FY19 and prior grantees who can close out during the July submission period are encouraged to do so. FY20 grantees will continue to report on and submit narrative questions in JustGrants during the July submission period. Okay, Katie has posted, review data points collected in the case management systems available. Use any pre-populated reports. We'll now review several best practices while collecting and tracking data. Creating a data collection plan requires a good deal of pre-planning and preparation. When creating a data collection plan, best practices include locating the performance measures for your program, understanding what each question is asking, and determining how to answer that question, even if that answer is a 0. Creating a plan to identify when and how you will collect the data. For example, what type of tool or instrument will you use to collect the needed data? And determining, has this tool or instrument been validated? Has it been used before? How accurate is this tool or instrument? And who will be using the tool or instrument? There are several best practices you can implement when collecting data for the upcoming reporting cycle. You want to be proactive in your approach as much as you can be. You want to designate staff for the coordination of the performance measure data collection process. You want to review the progress reporting questionnaire before entering data. You want to ensure that designated staff participate in trainings. You want to pay attention to communication from JustGrants. And lastly, if applicable, review, edit, and validate data with subgrantees before submission. Is there a grantee and subgrantee relationship? You're required to enter data on all performance measures that relate to activities described in your OJJDP grant application approved and carried out with OJJDP funding. As a grantee, you want to plan to collect data on behalf of all of your subgrantees. Some things to think about as you plan to collect and track data include timelines and resources. After all, this can be a lengthy data collection period as noted in your solicitation. Some questions that you may want to consider while planning include duration of data collection and document version control. Does your plan include a beginning and a middle and an ending date? How will you manage your documents over that time period? For example, will you track them with an Excel spreadsheet? Regarding location and access, how long will you store the data? Who will have access to it? And if it is shared placed on a shared drive, who is given permissions? Lastly, how are changes communicated? How will the data be validated and edited if applicable? We will now review several best practices during reporting. In the January 2022 reporting cycle, you will be reporting on the newly revised performance measures and narrative questions. Narrative questions provide you with the opportunity to answer or address the following topics. What do the numbers you reported on in your performance measures actually mean on the ground? How does your work impact your community? You want to use the narrative to walk the reader from the numeric output to the tangible outcome. And you want to use specific and detailed concrete examples to illustrate your point. Other things to think about include providing evidence to support conclusions, answering the question, what has funding allowed you to do that you could not do prior to receiving funding, and could include words like COVID-19 and pandemic when explaining COVID-19 adjustments to your program. On the screen, you see an example of the California Drug Court narrative for your review. Best practices for reporting in JustGrants. Common issues arise since you are required to respond to every question. When reporting zeros, if a measure does not apply, you can enter a zero value and then add an explanation by selecting the comments field. A brief description, such as we are still in our planning period, or there was no activity during the reporting cycle, are acceptable responses in JustGrants. Avoiding duplication and count can also be very challenging. Having more than one person review the data, for example, a program manager, can ensure duplicate data does not exist in your reporting. And as you know, reporting is awards-based. Another best practice for those of you with multiple awards when trying not to duplicate data is to spend down funds and create a final report of activities you performed for the oldest award first before beginning to enter data and reporting on another award. If this is not possible, prorate your quantitative data according to the amount of each award. And again, this is for those of you with multiple awards. Contact JustGrants with any concerns related to error messages found in JustGrants. You can save your data and resume data entry at a later point in time in JustGrants. And for more information such as this, please visit the YouTube video using the link provided on the screen and posted in chat. Lastly, you may want to contact the PMT Helpdesk for any questions related to progress reporting or reporting on the newly updated performance measures. You are encouraged to reach out to your program manager with any questions or concerns. As mentioned previously, some grantees may receive funding from other awards. A service should be reported under one program or the other. The same service cannot be reported under multiple programs. If you have difficulty tracking services for each specific award, work with OJJDP program managers to identify an appropriate method for prorating all services to allocate numbers to each award. You will be reporting on the activities that occurred between July and December 2021 in January 2022. Reporting deadlines are July 30th for the reporting period of January 1st through June 30th, and January 30th for the reporting period July 1st through December 31st. More information regarding reporting in JustGrants will be forthcoming. If you are a 2019 and earlier grantee, this training is not directed at you, but you are welcome to stay to learn more about the new measures. Regarding the 2020 and future grantees, even though JustGrants does not yet have the functionality to accept data for the new measures, these trainings are being conducted to ensure that you begin tracking data in support of the new measures. Doing so ensures that you can report your program data once the system functionality is available. Collecting and tracking data that contains personally identifiable information, also known as PII, should be done with consideration towards the Privacy Act of 1974. Broadly stated, the purpose of the Privacy Act is to balance the government's need to maintain information about the individual with the right of the individual to be protected against unwarranted invasion of their privacy. In accordance with this act, you want to collect only the data you need. If you are using printed materials, keep sensitive PII in locked desk drawers, file cabinets, or similar locked enclosures. And when using sensitive PII, you want to keep it in an area where access is controlled and limited to persons with an official need to know. Reporting in a pandemic. You should complete progress reporting to the best of your ability and submit it before the deadline. Every progress report form includes a narrative field or multiple narrative fields where you can provide additional information about the data. Use that space to explain any incomplete or missing data. You're encouraged to use the narrative field that asks for additional information about the effectiveness to describe COVID-19 related adjustments to programming and other activities not captured elsewhere on the form. If you cannot provide accurate count for numerical progress report fields because project partners do not have access to files, for example, you should leave those fields blank rather than providing estimates. As a best practice, you want to communicate setbacks and successes through the use of progress reports as well as with your program specialist. So how do you report on activities now that they've been shifted to online remote platforms and when you have not been collecting detailed data on individuals served like you did in face-to-face sessions? The short answer here is to do the best you can and make very good use of those narrative fields. I'd like to pass the microphone to Muniba, who will discuss various resources at your disposal and where to go for assistance. Muniba?
Thank you, Rebecca. Now we will briefly go over resources and where to find additional assistance. The PMC Helpdesk is available to help you with any questions you may have about responding to the progress reporting questions or performance measures. You can contact us by calling the number on the screen or emailing OJJDP pmt@ojp.usdoj.gov. For a faster response, we encourage grant award administrators to send us an email. The OJJDP PMT Helpdesk contact information is available on the screen. Our office hours are Monday to Friday, 8:30 a.m. to 5 p.m. Eastern Time, except for U.S. federal holidays. The PMT Helpdesk returns emails and phone calls within 24 hours, so please don't hesitate to leave a voicemail or email even after business hours. JustGrants support. If you have questions about the JustGrants system, for example, accessing the system, please call the number on the screen between the hours of 5 a.m. and 9 p.m. Eastern Time and Saturday, Sunday, and federal holidays from 9 a.m. to 5 p.m. Eastern Time. If you experience any issues with JustGrants, we encourage grant award administrators to reach out to JustGrants support. JustGrants information, such as instructions on locating, completing, and submitting performance reports in JustGrants, can be found on the OJJDP.ojp.gov website or by viewing the video available on the screen. You can also log into JustGrants using justgrants.usdoj.gov. Thanks. Now back to you, Rebecca.
Thank you, Muniba. Let's take a moment to reflect on what was just presented. First, we discussed each of the program-specific Juvenile Drug Treatment Court program performance measures, noting the specific instances where data would need to be collected and the type of data needed. Next, we discussed the best practices for planning, collecting, tracking, and reporting on data for the July through December 2021 reporting cycle. An important takeaway here is the fact that OJJDP understands that data collection has begun and organizations, agencies, and subawards need time to review, process, and create a data collection plan for these performance measures. Some indicators will be easier to collect than others. We encourage you to work with your partners and TTA providers on a data collection plan. So what is next? Next steps include the opportunity we all have to collect data that will inform change down the road. For our part, those changes come in the form of edited performance measures. You'll be receiving a fillable feedback form that you are requested to complete and return to the PMT Helpdesk once you have familiarized yourself with the newly updated performance measures. There is one form per performance measure with plenty of room for narrative. Providing us with feedback on the newly revised performance measures gives us the information we need to fully understand your needs or those challenges you face implementing that particular measure. Thus, collecting your feedback now on the newly revised performance measures informs the refresh cycle after the pilot year has occurred. For now, however, no planned changes to the performance measures are being considered, and we would request that you do not make any changes to any of the documents posted online or provided in training sessions. And that concludes today's session.